The basketball world was stunned by the news. Victor Wembanyama, the San Antonio Spurs young star, received a diagnosis of deep vein thrombosis, or DVT. This serious condition, involving blood clots in deep veins, abruptly ended his promising season. Wembanyama's case highlights the unpredictable nature of DVT, a condition that can affect anyone, even elite athletes. While DVT is often associated with leg pain and swelling, Wembanyama's case presented atypically in his shoulder. This unusual presentation emphasizes the importance of understanding DVT and its potential to manifest in different parts of the body. DVT is not just a sports injury, it's a medical condition requiring attention and care. Deep vein thrombosis, or DVT, occurs when a blood clot forms in a deep vein. Veins are blood vessels that carry blood back to the heart. Deep veins are located within muscles, often in the legs but also in the arms, pelvis and other areas. When a clot forms in these deep veins, it can obstruct blood flow, leading to various complications. Our bodies have a natural mechanism for preventing excessive clotting. However, certain factors can disrupt this balance, increasing the risk of DVT. These factors include prolonged immobility, surgery, injury, certain medical conditions, and genetic predispositions. Understanding these risk factors is crucial for identifying individuals who may be more susceptible to DVT. Early detection of DVT is crucial for effective treatment and preventing complications. While some individuals may experience no symptoms in the initial stages, recognizing the common signs of DVT is essential. The most frequent symptom is swelling in the affected limb. Other symptoms include pain, tenderness, warmth, and redness in the area. If you experience any of these symptoms, especially after prolonged immobility or surgery, it's crucial to seek medical attention immediately. Prompt diagnosis and treatment can significantly reduce the risk of serious complications associated with DVT. Diagnosing DVT typically involves a combination of physical examination and imaging tests. During the physical exam, the doctor will assess the affected area for swelling, tenderness, warmth, and changes in skin color. They will also inquire about your medical history, risk factors, and any recent surgeries or immobility. Imaging tests, such as ultrasound, are commonly used to confirm the diagnosis. Ultrasound uses sound waves to create images of the veins, allowing doctors to visualize blood flow and identify any clots. In some cases, other imaging tests like CT or MRI scans may be necessary to obtain a more detailed view of the veins and surrounding tissues. Section 5. DVT in different body parts, from legs to shoulders. While DVT most commonly affects the legs, it can occur in other body parts, as highlighted by Victor Wembanyama's shoulder case. DVT in the arms is less frequent but can still be serious. It often presents with similar symptoms to leg DVT, including swelling, pain, and tenderness. DVT in the pelvis is rarer and often presents with more subtle symptoms, making it challenging to diagnose. The location of DVT can influence the potential complications and treatment approach. Wembanyama's shoulder DVT, while concerning, is considered less likely to cause a pulmonary embolism than DVT in the legs. Section 6. Unraveling the causes. Why does DVT occur? Several factors can contribute to the development of DVT, often categorized as inherited or acquired risks. Inherited risks include genetic predispositions that make the blood more prone to clotting. Acquired risks encompass a range of factors related to lifestyle, medical conditions, and recent events. Prolonged immobility, such as during long flights or bed rest, is a significant risk factor for DVT. Surgery, particularly orthopedic procedures involving the legs or pelvis, also increases the risk due to tissue trauma and reduced mobility during recovery. Certain medical conditions, like cancer, heart failure, and inflammatory bowel disease, can also increase the likelihood of developing DVT. Section 7. Treatment options. Addressing DVT effectively. Treating DVT typically involves a multifaceted approach aimed at preventing clot growth, reducing symptoms, and minimizing the risk of complications. Blood thinners, also known as anticoagulants, are the cornerstone of DVT treatment. These medications work by preventing blood clots from getting bigger and reducing the risk of new clots forming. In some cases, Clot-busting medications, called thrombolytics, may be used to dissolve large clots or those causing severe symptoms. These medications are typically administered intravenously or through a catheter directly into the clot. Compression therapy, using graduated compression stockings, helps improve blood flow and reduce swelling in the affected limb. Section 8. Athletes and DVT Stories of Recovery and Challenges. Victor Wembanyama's case is a stark reminder that DVT can affect anyone, even elite athletes in peak physical condition. Several other athletes have faced DVT diagnoses, highlighting the importance of awareness and early intervention in this population. Chris Bosh, a former NBA star, experienced a career-ending case of DVT and subsequent pulmonary embolism. His story underscores the potential severity of DVT, particularly when it leads to complications. Serena Williams, the renowned tennis player, also faced a life-threatening pulmonary embolism after developing DVT following the birth of her daughter. Section 9. Prevention is key. Protecting yourself from DVT. While not all risk factors for DVT are controllable, there are several steps individuals can take to reduce their risk. Staying active and avoiding prolonged periods of immobility is crucial. If you're on a long flight or car ride, make sure to get up and move around every hour or so. Maintaining a healthy weight and staying hydrated can also contribute to DVT prevention. If you've recently undergone surgery, follow your doctor's recommendations for activity and recovery. If you have any concerns about your risk for DVT, talk to your healthcare provider. They can assess your individual risk factors and recommend appropriate preventive measures.